help us understand whether we can work this conversation out from a regional perspective. Are we able to say what the state of nutrition is for the region?
Of course, each country has its own statistics,
right.
And you know, with malnutrition, it's not just one thing, it's many things in there. There's stunting, there's underweight, there's wasting for children,
right.
Then there's also underweight for adults. So each country has specific statistics that you cannot just bring down into one thing.
All right, let's talk about now that same thing. If we take a look at the news that is put out or the kind of policies that are placed from a national level, it's not as often that you hear nutrition mentioned more than once over a month or so, but in Rwanda the case is different. Why do we see, let's say like for example in the case of Uganda, why do we not see it as part of a priority or fit into different ministries to work its way along the policy line as much as we would want it to?
It's actually there.
Right.
Everyone's screaming nutrition because
right.
It's very, very important. So in Ministry of Agriculture, there's nutrition, Ministry of Education, gender, because in order to combat malnutrition, we need a multi-sector approach. So very many ministries are becoming aware of it, and that's why it's being incorporated in various sectors.
Right. In the case of Africa Improved Foods, there were partners that came on board, and we saw 4 new partners when the plant was being launched. This helps when you're such a partner, but we'd like this conversation to move from just one person to a lot of industry players within the same that might not have the same financial capital. What case is being made to support each other for a collaborative approach?
Mainly sensitization, because what Africa Improved Food does is, one, it supports farmers out there because all the raw materials that are used are from farmers,
right.
And then we try as much as possible to make sure that the seed is really of high quality. We look at aflatoxin mainly. So if we want other companies out there to be able to, in a way, let me say, copy whatever Africa Improved Food does, because at the end of the day, we don't want it to stay within just one place. We want all the other companies out there to think about safety and health of their consumers.
Speaking of the same, you had a conversation before, I think in 2016, where you said imports do not necessarily improve the diet of those who eat them, of certain foods such as millet and sorghum, locally made foods would. But this can be taken differently because the importation level of different foods and genetically modified foods is still very rampant in the region. Just give us your thoughts on this.
The reason as to why I said that imports might not necessarily improve is because of the sustainability. You know, when things are imported, that means they're going to be much more expensive.
Right.
And we want everything to get down to the poorest person down there. If you use locally made things, then the price will be a little bit more affordable by everyone out there. So imports could be okay, but it's more sustainable to use things within, you know, the local settings so that everyone is able to afford whatever you're producing.
Let's talk about the local farmers. Now, they play a very crucial role in terms of also being mobilized to work on this conversation. But do they understand, or most of it is either commercial factor or subsistence farming where they just cater to the money or the family. But do they understand the role that they play within the economy?
I think they do, because imagine if your maize got rejected. It could be commercial initially,
right.
But it gives you a purpose because you know I have to have safe seed in order for me to actually, at the end of the day, get money to use for my family.
Right.
So at the end of the day, it becomes more than commercial. It becomes something that they actually have to do because they set standards. If your seed is not good, the company will not be able to take it. So right. It goes way beyond just the money.
The reason why I'm asking that is because in the past, within the region, farmers have been struggling with post-harvest losses. They're still working on the same. They are still working on mechanized farming. So how do you get them now to say, in between all this, we still need you to provide very nutritious foods and to a certain scale?
It's motivation. Actually, you know, what Africa Improved Food does is it works with the farmers directly. They don't just go and get the seed. They do quality checks to make sure that after the farmers harvest, they dry the maize properly, for example. Right. They package the maize properly. So it's a long chain and not just one thing. So during transportation to the factory, they have to make sure that they follow quality procedure. So at the end of the day, you know, they get a bit of support from a lot of support right. from the factory.
All right. Now, this is a follow-up conversation to one that we had. We had a research organization called the Potato Center that was talking about urban farming and the link between urban farming and nutrition. And one of what they proposed was for most households to now practice kitchen gardening. which is tough in different landscapes, because, for example, in Uganda, the household system there, or the mapping of maybe the cities, does not allow for any space for farming. If you live in an apartment, also you have to be in a certain area. But how do you work out such a conversation now, at least country by country? Help us understand your thoughts. How interesting is this?
Who says kitchen gardens need land?
Right.
With kitchen gardens, a person can use a bucket, you can use a jerry can, you can use a tin, because you can use a sack. Because actually, have you seen sacks?
Right.
There's lots of vegetables that can be grown in sacks, in buckets, in jerry cans. So at the end of the day, all you have to be is innovative. If you don't concentrate on having an actual piece of land and think outside the box, then it can happen. Even if you live in an apartment, you can at least put a sack on your veranda, can't you?
Right.
And from that, you can get lots of carrots, lots of amaranthus. So it's not about the land, it's about being creative.
My final question has to do with what Rwanda has planned to do, and still on the same point. Now, they've said that they want people, at least over 30%, to move into cities within the next 10 years. How can people in urban areas manage their nutrition habits and live healthier, knowing all the facilities that come with all these foods and the fatty oils are based in the urban areas?
The thing is, there are two types of people. In the rural areas, people depend on whatever they grow mostly, and in the urban areas, people depend on markets.
Right.
So as long as there are efforts to make sure that what is out there in the markets is healthy, and even if, it's okay to indulge, because nutritionally we believe there's no good or bad food.
Right.
So if people are sensitized to be able to indulge, but be able to curb whatever they're doing to eat responsibly, then I don't think that will be a problem. So whatever is in the markets, people should strive to make sure it's healthy. And then even if it's in the supermarkets, you should try to make a balance and make sure that whatever you're consuming is going to improve your nutrition outcomes.
You've been very vocal about this particular topic and combating malnutrition. What's been the largest repetitive impediment that you've had working up with the same?
It's usually because, the biggest thing is people believe that you need money in order to eat well. So that mentality is killing everything.
Right.
Oh, if I don't have money to buy beef, then I cannot eat well. Or if I can only afford silverfish, then I cannot eat well. So that mentality is one of the things that's hindering people to actually get out of, that malnutrition box and try as much as possible to remain healthy.
Right.
So for me, I believe all food is good, all food can be bad. So if people stop thinking that you need to have money in order to eat well, then we'll be very many steps forward.